Hi guys, Dr. Renato here with the Well Chiropractic. Today I want to talk to you about what causes headaches, what causes migraines. So I'm going to give you a really basic anatomy lesson. I'm going to show you through what normal looks like, and then I'll kind of explain to you how we get headaches, how do people get migraines. So here I have a set of digital motion study x-rays, and we do this with most everybody here that comes in the office, and I'm going to give you two reasons why. And that is because I don't want to guess when it comes to your health. I don't want to guess when it comes to my health, your children's health. And number two, we're able to figure out exactly which bone in your neck, in your spine, is the problem, is the culprit. Because the whole idea of chiropractic is based on this concept that there's a bone putting pressure on a nerve in your neck, causing like headaches and migraines. So I'm going to show you what normal looks like, and I'm going to show you another picture that it's not so normal, and I'll explain to you what's happening. So here I have a set of pictures, if you want to pay attention right over here, if you're looking at an x-ray of the spine from the side, I want to see a bit of a curve right there, about 35 to 40 degrees. And then a really important part of the cervical spine is this top bone here in our neck, okay? And I just want to be able to make sure that you guys see that. So this first bone in your neck here, known as the atlas C1, should be nice and angled up like an airplane, just like I have it pictured here, because when that structure is pointing upwards, that is your normal structural position for that bone. And these films here are actually, that's a pretty good looking neck. And this here is my friend Dr. Tyler Peterson. He's a chiropractor out in Corner Store Chiropractic in Woodbury. So the reason he has a nice looking neck like this is because I'm his chiropractor, I'm his doctor. So that's normal structure. We want to see a bit of a curve. We want to see this first bone pointing upwards. And another thing that we do in the office is a motion study. So I take your spine through flexion and extension because I want to be able to figure out exactly which bone specifically is the problem. So now let me show you another patient that doesn't have as good of a spine that we are working on helping right now. So here's a picture of somebody, and see what's happening here. So we don't have that curvature. In fact, this patient's spine is almost going into the reverse. So we don't have the curve, and look at that first bone, that atlas right there, C1. It's flat, it's straight, right? So let me show you here on this model what's essentially happening. So this first bone is right here. This is my friend's spine. So what's happening is that when this bone is not pointing upwards, it's not tilted at an angle like that, it puts pressure on this structure back here, which is your brain stem, and this controls a lot of really important functions in the body, like blood pressure, anything head related. So puts pressure on that, and also what this bone tends to do is it will rotate. It will rotate, and then when it does that, pay attention here. See this red plastic structure? That's your vertebral artery. So that puts pressure on that, and that's when people experience like those pulsating, pounding headaches. So we want this to be nice and angled upwards, and here we see that that's not. So this patient is missing the cervical curvature, and of course that bone is flat, and this bone here is really notorious for headaches and migraines. So that's what we're working on, trying to change the structure of the spine, trying to help that bone to angle upwards and put that curve back in her neck, to number one, get her back to where it should be, and then prevent anything further from happening. So I hope you guys enjoyed that. I hope it was informative and helpful to you. If we can be of any help with headaches or migraines, definitely give us a call and reach out. So thank you so much for watching.